have a conversation with good folks from Virginia Mason
Memorial
Memorial Hospital.
That's right. That's right, Dave.
Good morning. Who's all on the
Good
line
morning.
with us this morning? Is this Dr. Marty Brueggemann?
It is. Good
How are you,
morning.
Doc? How are you?
Oh, I'm good today. How are you?
Good. Medical Director, Virginia Mason Memorial. Is that the official title?
Chief Medical Officer.
Chief Medical Officer. All right, I want to get it right. Hey, I appreciate you coming back. Last time we talked about 2 weeks ago, we were looking at one scenario. Obviously, as fast as things change and information is made available and then becomes irrelevant and new information becomes available, what's your take on where Yakima is at with the coronavirus and COVID-19?
Yeah, thanks. I appreciate that. It does evolve very quickly. However, we do find ourselves right now kind of in a little bit of a plateau or steady state over the last week or so. We still have about 20 positive patients in the hospital, and the numbers in Yakima County do continue to climb. Currently, there's 886 as of yesterday evening. And we continue to see patients dying from this, and we've had 38 deaths now. So we're kind of right now in at or near the peak of the infection, we hope. You never know these things until you get through it and look back on it. But it does appear as though we're probably in that peak phase. And I got to give a shout out to the Yakima community that you guys have done a really good job with the physical distancing and listening to the recommendations. Because we truly have seen fewer cases than what we feared we would see, and so we need to continue to do that to follow those recommendations. But good job to the community for doing that.
Well, amen. I guess the question that I would have for you first is, without getting in the crosshairs of HIPAA laws and all of that, are the folks that are in the hospital, I mean, are we at risk of losing 20 more, or are these folks that just need, do we have, respirators, ventilators on people, or how are we doing?
Yeah, there's several people who are on ventilators. That's a little bit of a moving target. We do get some people who we are able to get off of the ventilators, but every day we have more go on. There will be more deaths. There's no doubt about that. And we will continue to see that 38 number continue to climb over the next few weeks. One of the challenges is when you look at the peak, it's not a true bell curve. Usually the numbers climb quickly on the front end, and then it takes a long time for things to taper off on the back end. And that's one of the challenges for people, because I know the weather's getting nice. People have been doing this now for 6 weeks. They're starting to get antsy. They want to get out. They want to see their friends. They want to enjoy the weather. But it's as dangerous now as it was a month ago. And if we let our guard down and we all start going back out to the stores in big groups and not wearing masks and things like that, we will see a second peak. And we've seen that happen with past pandemics if you look through history.
It is frustrating because you figure it's been a month since it got really roiling, and most people figure, well, my course of the flus that I've had took me about a month and I was fine. So a month in, it almost seems like, yeah, we should be done with this, but yet we still have more and more folks popping up as we go. What's your sense for the non-symptomatic, asymptomatic carriers for Yakima? Do you have any reason to think that we have a big population that's already had this, didn't know it, and that's what's spreading it around, or is it possible to tell?
It's, I know we do. And in fact, we periodically will get insight when we get a couple of patients from let's say a warehouse somewhere. I won't name any names or anything like that. But let's say you get a couple positive from a warehouse. So you go in and you do mass testing. What we'll discover is there's a fairly large contingent of that particular population that tests positive with no symptoms. And that's one of the things that's challenging about this one is the incredibly wide spectrum of disease courses for people, going from the asymptomatic to the people who are dying. And we have had young, healthy people die from this. So it's a very real thing for everybody.
I got to ask you this. A Facebook comment and a bit of city council controversy suggests that one of the councilmen said, "Hey, look, vitamin C and zinc will harden you to COVID." I mean, it sounds like everybody should have as much immune strength as possible, but is that going to stop COVID-19?
No. Well, let me back up a little bit. If you are taking care of yourself, if you are eating a good diet, if you're getting what exercise you can under the circumstances, getting good sleep, taking care of your emotional health, things like that, it will make you as an individual have more likely to be able to fight things off. We know people who are under stress, who are not taking care of themselves, are more likely to fall victim to illnesses. But there's no magic pill here. There's no treatment. Even some of the things we've been looking at, the hydroxychloroquine that some of our governmental leaders have come out and said, hey, everyone needs to be taking this. As we study them, we find that there really isn't good data to support that it does anything. In fact, with hydroxychloroquine, there have been some studies that show you actually get worse. So, these are things that we will use in certain cases, usually when patients get so ill that we feel like we need to just pull out all the stops to try and save them. But for routine kind of prevention for people with minor illnesses, there is no treatment that's been proven effective. You can take all the vitamin C and zinc you want, and if it makes you feel better, great. I guess maybe it'll boost your immune system from a psychological standpoint, but it's not going to prevent you from getting COVID.
Doctor, we are reporting the Yakima Health District are telling us, because you just said that you've had young, healthy people die of this disease. Yakima Health District says 37 of 38 recorded deaths were people who had underlying health conditions. We've had no deaths in the people 0 to 19 and 20 to 29. So how are we to believe that young, healthy people have been dying? Are you talking about Yakima County, or are you just talking about in general?
I guess I was talking more globally.
Okay. Yeah, all right.
We've certainly seen and talked to our colleagues in other places who will tell us about people that are in their 20s. In fact, we have had our first under 10 death. I believe it was in Chicago. I could be mistaken on that, but we definitely know this isn't as bad for the young people, which is good, but it doesn't spare them completely.
Gotcha.
Well, sure, no.
Is anybody collecting information from us, forming the national database? Are we reporting into anybody with what our circumstances are to the state or whatever?
Oh, absolutely. I mean, Health District is part of the State Department of Health, and they, of course, keep data on every level, county, state, national, and then worldwide level. The data's all out there. I can tell you in the country we're approaching 1 million deaths, or not deaths, 1 million cases, confirmed cases, and as of yesterday, we were right around 46,000 deaths nationwide from this. But on those cases, I just put the caveat, and the same thing with Yakima County, those are just tested people. And we continue to have major challenges in getting a hold of the proper equipment to do testing. So the 886 cases that we're reporting in Yakima County, I can tell you will dramatically underestimate the actual number of cases that we see.
Yeah, what if we've had 2 million nationally instead of 800,000? How would that skew anybody's approach to dealing with this, or would it?
Well, from the medical community, it would not skew our approach. It might create more visibility for the general public. And I'll tell you, I guarantee you there's more than 2 million cases in the country, because everybody's running the same challenges we are. There's literally millions of cases in the country.
Then there just seems to be no end to this.
Well, if we had 60 million cases in the country, which the number I saw on swine flu, I guess it's reasonable to think that we'd have millions and millions of cases of this too, just because of lifestyle. And even though we are doing a good job of slowing things down by everybody's measure, but there's a lot of calls and protests to get us back to work. you know, governments
tell you
governments refusing to comply, like Franklin. So, Franklin County, what's your take on that?
That scares the heck out of me, to be honest with you. When I see protesters out there and I hear a suggestion that we should go back to business as usual, you will set off another spike. And we can show from past pandemics where they've made similar decisions, and you can clearly show a second spike, and sometimes that's worse than the initial one. With all the success we've had, there's also a bit of a warning in that message in that a lot of people have not gotten it, which means there's a large segment of our population that still is susceptible to this. The whole goal of trying to lengthen out the course of this and not get a bunch of people infected up front is not only to not overwhelm the medical community, but to buy us time to learn more about the virus, to try and develop a vaccine, to see if there are treatments we can use, and then also see if we can develop testing to find out who has successfully developed immunity to it. And that's a big moving target right now. There are some tests out there, but the initial reviews are very spotty in terms of whether we can really predict who's developed immunity to it. Once you get those tools in place, it allows you to manage the disease a lot better. And that's the advantage we have with influenza when we see those pandemics, is we do understand the flu virus a lot better. We do have testing for that that's a lot more widespread. We do have vaccinations that are kind of ready to go for that. We just have to make adjustments based on which particular proteins in the virus are the predominant ones that year. So if this were an influenza pandemic, there would be some significant advantages. The problem with this coronavirus is we don't have the same level of scientific information around it. We don't know, we don't have treatments developed, and we certainly don't have any vaccines against it. So we really need to weather the storm on this first one using the physical distancing, and then buy our researchers time to try and figure out some of these other things that will allow us to respond with a much more, what I would call, surgical approach this fall when it comes back, and it will come back this fall.
So we're about out of time, sir. I guess I'm not putting words in your mouth, but you sound to be giving us a message of stay the course, because we need the time to keep from being overwhelmed and to collect the data to stomp it out when it comes back again. Fair enough?
Out there, we need you to continue it, so thank you.
Thank you, sir. Appreciate it. We'll look forward to future chats with you.